So I'm going to go ahead and get started. And if anyone else jumps in, that's fine. If you have any questions along the way, any comments, or anything that you want me to answer, please just put it in the chat and we'll go through the questions at the end. If you put them in the chat, it'd be great because then we can go back and just round up all those questions and I can just go through them one by one. So I'm Tracy Cook, and I'm actually the lead faculty for the dental assisting department or the dental assisting program. And I also teach in dental hygiene. So I'm just going to share a little bit with you about my background and a little bit about me. And I'm just want to welcome all of you for coming and showing an interest in the presentation today. And I'm just thankful that all of you are here. So I went into dental assisting right out of high school. So just like many of you that are probably just coming straight from high school, I went into dental assisting school right out of high school. I didn't know what exactly I wanted to do. I liked people. I worked a lot of jobs like fast food and retail and things like that. And so I knew that I liked talking to people. And I knew that I needed to earn money to take care of myself. I was on my own 5 days after I graduated from high school. My mother dismissed me from the household and I was on my own. And so I was living with friends, sleeping on couches and things like that. And so I needed to earn an income that would help me take care of myself. So graduated from high school and I got into the dental assisting program and it was great. I was able to learn a lot. I was very engaged. I think I had a little motivation because, you know, I was in this program and I needed it to work out for me so that I could, you know, have better opportunities to take care of myself since I was on my own. And so I went through the dental assisting program with, at that time was a year, and our program is also a year, and got to work right away. And my first job was on Capitol Hill. And it's so funny because it was literally down the street from where the main campus of Seattle Central College is. And sometimes when I would have a long lunch break, I would walk up there and sit on the grass and things like that, never knowing that I would be an employee at the college. But so I was a dental assistant for about 10 years. And then I went back to school and became a dental hygienist. And so I've been a dental hygienist since 1999. So I've been working in dentistry for more than a few decades, and I still really love it. It's got great opportunities. And one thing that's so exciting about dental assisting right now is it's in very, very high demand. I've been getting emails and phone calls and messages for doctors looking for dental assistants all the time. Our class of 2020 that graduated last August, we're all employed. And the class that is in session now are in their third quarter. They're all working 2 days a week in internships. Starting June 28th, they'll be working 4 days a week in externships. And there's no doubt in my mind that they will all be employed. That's just how hot the market is. As a matter of fact, they're going to have choices on where they work. So it's really, really, really a great time right now to get involved in dentistry. And the one thing that's really nice about it is that our program goes really fast. We're busy, we're in the clinic, we're interactive, and I try to make it fun. And so it's just like a family setting. That's kind of like how we like to run it because we work so closely together and we're working on each other. And so it ends up becoming like another part of your family. So I'm going to go ahead and share my screen. That's a little bit about me. And we'll go ahead and get a little bit more into what Seattle Central College has to offer in our dental assisting program. I'll also share a little bit about dental hygiene. As I said before, I work in dental programs, and we have both programs within the school. So welcome again. And let's see here. So what is the profession? So dental assistants provide patient care, work chairside with the dentist to treat patients. Dental assistants take x-rays, they polish teeth, and there's all different types of specialties that dental assistants can go into. You can work in orthodontics, which is braces. You can work in oral surgery. There's a couple different forms of oral surgery. There's your regular oral surgeon that takes out wisdom teeth and things like that. And there's also periodontics, which specializes in implants, gum surgery, bone replacement, bone remodeling, all different kinds. And that's pretty surgical. And it's very fascinating. I worked in oral surgery and periodontics and orthodontics and pediatrics. So I've worked in lots and lots of different forms of dentistry. There's cosmetic dentistry, which specializes in, you know, what you would see like an extreme makeover, where people are just really, really concerned about how their teeth look. That's cosmetic dentistry. And there's just, like I said, a lot of areas that you can branch off into. And there's several opportunities for growth in dental assisting. So a lot of the office managers in dental offices were former dental assistants. You can branch off into insurance billing. You can become the office manager. You can be the clinic coordinator. And just another little example of what you can do with dental assisting. My cousin was a dental assistant, and in dental assisting, you learn how to pass dental instruments. Well, she took the skills that she learned in her dental assisting program and applied for a position at Swedish Hospital as an operating room technician. And so she works at Swedish Hospital doing major surgeries. She's well requested. She's busy. She's making excellent money. And so those same skills that you use to pass instruments in dentistry, they can be transitioned into an operating room because you're passing instruments. And so there's lots of ways that you can take your dental assisting experience just simply by thinking outside of the box. So what do you do in the dental assisting? You know, here's a little quick video about what you do. So that was just a little quick video, and that is actually in our student practice lab. And so it's really big. We are located in the Pacific Tower up on Beacon Hill. That's where all the health education departments are. And it is a beautiful building, beautiful scenery, well lit, just really nice. So where do dental assistants work? Well, dental assistants can work in private practice dental offices. They can work in community clinics. And speaking of community clinics, Seattle Central College's dental assisting and dental hygiene department partner with Neighbor Care Health. And we actually have a 30, I think it's 30 operatories right there in the building. And so our dental hygiene students and our dental assisting students work on patients right there, connected with our education. So even first quarter of the dental assisting program, you'll be going in, taking blood pressure, pulse, seating the dental patient, putting the bib on. You'll start having interaction with the patient first quarter. Second quarter, you'll have a full day working on patients in the dental clinic, taking x-rays, suctioning. Third quarter, which is what we're at now, the students are 2 full days in the dental clinic and in off-site dental offices doing internships. And that's been working really well. And then fourth quarter is the externship. And you'll actually be 4 days a week working in a dental office. And you'll come for class just 1 day a week. I think it's 1 class, fourth quarter. And historically, what's been happening is the places that the students have been doing their externships at, that's where they've been getting hired. And so it's been a really, really great opportunity. So dental assistants provide patient care. There's laboratory duties that dental assistants do, such as taking dental impressions, which create study models of people's teeth. And so those get poured up in the lab. Dental assistants prepare for the procedures that are being performed. And so a lot of that preparation is before the procedure and then breaking down after the procedure. The dental assistants pass and use dental instruments, take x-rays, suction, handle scheduling, sterilize equipment, document the chart, and keep the dental record. And also, most dental assistants are in charge of ordering dental supplies. So there's ordering and checking in supplies and just maintaining the equipment in the dental office as well as the supplies. So program information. So the Seattle Central Dental Assisting Program is a 1-year program. It includes 3 quarters of clinical and classroom instruction with an internship. And then the 4th quarter is an externship in a community clinic or private dental office. The weekly class schedule is approximately 4 days a week, and we are doing hybrid. So we're in class and we're also online. And so there's a mixture of online and in-person, face-to-face. And a lot of people ask when I do these sessions if dental assistants are still having the opportunity, or dental assisting students still have an opportunity to work. And I have about half of the class that works a part-time job on the weekends. So another interesting question that comes up all the time is, how much do dental assistants get paid? So in this next graph, we're going to go from the low end of the scale to the high end of the scale. Here we go. And these were King County employment wages that I gathered back in 2020 prior to the pandemic. So dental assistants, probably more on the south end. The low end of the King County was $15.38 an hour. Since the pandemic has occurred, there's just been a big influx of a need for dental care. And that would be really, really low. No one in the class that graduated last year in 2020 earned under $20 an hour. So 25% of dental assistants graduating would earn $17.31 an hour. 50% would earn about $43,000 a year, which is about $20.67 an hour. 75% of dental assistants will make about $52,000 a year, and that would be an average of $25 an hour. and 90% of dental assistants graduating from the program will earn about $62,000 a year, and that's about $30 an hour. Now, the location has a lot to do with how much you earn. So demographics is involved. So if you work downtown, Bellevue, Issaquah, the East Side, Bremerton pays dental assistants and dental hygienists really, really well also. So demographics has a lot to do with it. You will earn a higher wage in dental assisting depending on the location in which you work. So I just want you to keep that in mind. Here's a video that talks about dental assisting versus dental hygiene. And it is a quick video. I think it's about 3.5 to 4 minutes. And I'm going to go ahead, and this should answer a lot of questions that you might have about what's the difference between a dental assistant and a dental hygienist.
Hi guys, welcome back to Dental Vibes. I'm Carla.
And I'm Gabby. And today's video will be super short. This video will be for anybody that's considering the dental field out there and they're not quite sure if they want to be a dental assistant or if they want to be a dental hygienist. So we're going to clear up some confusions and distinguish the two.
So the first thing is, number one, schooling is totally different. To become a dental assistant is basically just go where, you know, they're offering the program and you just go in, pay for it, and you get your certification. And sometimes there's a lot of dental assistants that have just walked up to a dental office. They're like, hey, I'm interested. And if they're able to, they will train you on the job. And then later on you go and get your certification. However, for dental hygienists, totally different. You have to get your associate's degree, and during that time you get your prereqs, whatever the dental hygiene school is requiring. You have to get accepted, keyword, into the program. It's very competitive.
It is.
And I think it's about what, a 2-year full-time during hygiene school alone. So definitely way more schooling, obviously more expensive, a little bit more time. So that's point number one.
Yeah, so another thing that's completely different is the duties, right? So a dental assistant will assist the doctor with every procedure, with everything. Even will assist some hygienists as well. So cleaning up their instruments, suctioning for them. So we will assist and do everything in the office. Hygienist, on the other hand, all you will be doing will be cleanings, x-rays, and sometimes sealants. So your day will be cleaning, x-ray,
They have
some
their own
sealants.
schedule separate from the doctor.
Yeah, so it's completely different when it comes to duties.
Yeah. Number 3, a big one, the pay, obviously. Dental hygienists do more schooling, and so they make more money.
Just makes sense. More schooling, more money.
Yeah, so almost probably
twice as
much as a dental assistant, if not a little bit more. So there you go, big difference right there.
Okay, so the fourth difference is the scheduling. So the schedule of a dental assistant involves the dentist 100%.
Yeah.
So you finish whenever your dentist finishes. If the dentist is not coming into work or is on vacation, you're probably not going to work. As a hygienist, you have your own schedule. You have your own room. You pretty much have your own patients. So whenever you're done with your patient, you pick up your things and you leave. If the doctor is on vacation, you can still come in and do cleanings. So that's completely different when it comes to scheduling.
Yeah, so it's like they have their own flexibility to sometimes make up their own hours, work less, work more. It just depends. So there you guys have it. This is a very quick generalized video on what are the differences between a dental assistant and a dental hygienist.
Yeah, and we're not necessarily saying one is better than the other because they're two different positions. two different pays, two different schoolings. So it's really a personal choice, whatever you feel like you want to do. But we are assistants. We love what we do. Some assistants would say that they don't want to do hygiene. So that's totally up to you.
Yeah, and you know, you can always be a dental assistant first, and let's say you're like, oh, maybe I wish I would have done that. You can always go ahead, do the schooling, and graduate as a dental hygienist. So there's always that opportunity.
Absolutely. Okay, so don't forget to like this video. Make sure you guys subscribe to our channel if you like some more dental tips. Make sure you check us out on Instagram as well if you like dental memes.
Also, don't forget to leave us a comment below. Are you torn between being a dental assistant or a dental hygienist? Let us know, and we'll see you next time. Keep smiling.
So I hope that was a helpful video just to give you guys an idea of what the difference is between a dental assistant and a dental hygienist, and I happen to be both, so I can answer those questions for you. How to get started in the dental assisting program? Well, I just want to let you know that the market is amazing right now. Again, as I already said before, we have been having so many calls for dental assistants. We are starting our program on June 28th. And so we have some deadlines to get into the program for this next incoming class. And I believe the deadlines are like May 25th is the deadline. We have a mandatory orientation that is May 27th. So if you join this next incoming class, starting June 28th is the first day. Again, the deadline is May 25th. We are also part of the Seattle Promise program. So if you are a Seattle Promise student, you can go through Seattle Promise for our program as well. But you will graduate next June. Now, here's another thing that's really cool about our dental assisting program. If you take 6 additional classes, which are English, math, and a biology class and a couple of electives, when you graduate from the dental assisting program, you will have your associate's degree in technology. So a lot of the students that are currently in the class now have been taking some extra classes at the same time, and they are going to be graduating with their associate's degree. To get into the dental assisting program, the eligibility requirements require that you're eligible in English 98, math 87 and 91, and you have a high school diploma or GED. And we have academic advisors that can help you with eligibility requirements, and we also have different resources for funding and all types of things. We have a very supportive team that can help you get going and get registered and get into the program and get started. So I'm excited about that. So here are some of the prerequisites that you have to take to get into dental hygiene. So dental hygiene is not a program that you can just start in June in summer quarter like this program. This program, dental assisting, is like, as long as you have your math and your English, you can get started in the program. Dental hygiene requires prerequisites, and you also have to get accepted into the program. And here's a list of some of those prerequisites. General biology, anatomy and physiology, microbiology, chemistry, and it's typically inorganic and organic chemistry, statistics, human nutrition, English composition 1 and 2, intercultural communication, psychology, and I'm not sure if sociology is on there, but I know that I had to take sociology when I went. So there's a few other classes that some colleges recommend. So here's the contact information for the dental hygiene and dental assisting programs. Again, I work in dental assisting. I'm going to put my email here for anyone that wants to send me a message directly about coming into this next class that's getting ready to start. I would love to have you as students. We're having a great time. All right, so I'm ready for any questions. Should I just read them out of the chat, or here? I'll stop the screen share. Okay. Let's see.
Hey Tracy, I didn't see any questions pop up in the chat, but I did have something maybe to facilitate kind of the discussion as
Sure.
we wrap up here.
Okay.
Could you talk about what are some of the favorite things about the job in kind of trying to align what you've experienced to maybe some of the preferences of the students to see, you know, maybe if they like to do that as well?
Okay, well, right now we are working a couple days a week in the neighbor care clinic. And some of the favorite things that the students would like to do right now is they like to assist with dental extractions.
Yep.
So they're really, really loving the oral surgery part of it.
Mhm.
And so it's kind of like, that's the hot thing right now. Oh, an extraction. I want to do it. I want to do it. I want to do it. So they're all fighting over getting to do the extractions. The thing that's really cool about it is if you're really into doing extractions, then you can always get a job at an oral surgeon's office. And oral surgery is exciting. I mean, you really, really get to learn a lot. A lot of oral surgeons' offices do IV sedation. So it's like they, you know, when people get their wisdom teeth taken out, they get put to sleep and they get monitored. So there's like a lot of like higher level of equipment in an oral surgery office. That's kind of like, you know, a little bit between, you know, the hospital and a clinic. And then the other thing that's really cool is that, you know, some oral surgeons do surgeries in the hospital, especially if someone gets their jaw broken or if they get a jaw replacement, and they take their dental assistants with them and perform the surgeries in the hospital. So that's really cool. And, you know, the money is not bad at all once you get a little bit of experience under your belt, you know what I mean?
Yeah.
And so, you know, you're really, really, you know, really earning a lot of money and you're in a really great profession.
Mm-hmm. And the demand is quite always going to be there, right? Yep.
You know, this is, I mean, we are just really seeing a big demand right now. And not only is it in demand, but some of the offices want to pay the students while they're in school.
Yep.
Just to make sure that they stay with them.
Right.
So, and that's another thing that because right now it's hard to get dental assistants and dental hygienists, the offices are kind of upping their package. They're upping their pay. They're offering benefits for medical and dental. And they're also giving retirement packages. And so they're trying to like make sure that whoever they choose to hire doesn't want to look across the fence to go somewhere else.
Right. Retention. Yep.
Mm-hmm.
Yep.
Wait, so if like a pregnant woman wants to get her wisdom teeth out and like they don't have to put her asleep, right? Because it's like a risk for the baby and her.
Depending, I mean, so when they do put a patient to sleep, what they do is sedation. And so sedation isn't like being put to sleep, fully asleep, like you're asleep at the hospital. It's like, it goes in through an IV, but it puts you to sleep, but not a deep, deep sleep like when you're at the hospital. It's a sedation versus a general anesthetic. But typically when people are pregnant, because we definitely as dental providers want to put the baby, not to put the baby at any risk, we only typically do procedures that are extremely necessary for a woman that would be pregnant and getting ready to have a child. That's not something, any routine treatment is always delayed a little bit until after the baby is born, unless the mom is in pain. Anybody else have any questions about what dental assistants do or anything you're curious about? No question is, off the table. So whatever you want to ask.
So like if somebody like doesn't want to get there, like they want to be asleep, like is it if like they want to get their wisdom teeth out, is it obligatory to go to sleep or you have another option?
I did not get put to sleep with any of my wisdom teeth extractions. And the reason why I didn't get put to sleep is because when you get put to sleep, you have to pay more. And I didn't want to pay more. And I was like, nah, just do it. So I stayed awake and it was fine. You don't have to get put to sleep. Are you getting ready to get your wisdom teeth taken out, Giovanni?
Yeah.
Okay, good question. You should ask them for nitrous. Nitrous is the laughing gas, and that helps to relax you. And you usually have a little bit of fun by the time you're done.
One more question.
Absolutely.
So to get into this position where you're at, like what does it take? What does it take for you, like just to be like in this upper level?
Oh, you saying like upper level as in a teacher or going to be a hygienist, or what do you mean? What is upper level?
Like going to be like a hygienist.
Okay, so I went through a 1-year dental assisting program when I was 18. And so I did that back in the 80s when I was in high school. And so I was a dental assistant for 10 years. And when I was a dental assistant, I actually worked for the Department of Corrections. I worked in a prison for 10 years. And so as a state employee with the prison, you get what's called tuition reimbursement or tuition waiver program. Because remember, I told you at the beginning of the story, I was on my own. Okay, so I was like taking care of myself. I wasn't getting support from my parents. So I had to get creative in how I managed what I wanted to do next. And so because I got a job working for the state, I utilized the benefits that they had to offer. And so I started going to school at night, taking like 1 class or 2 classes in the evening. And my job actually paid for my prerequisites for dental hygiene school. So the way the tuition waiver program works is if you registered for a class at Seattle Central College, as long as the class is in full, you can join that class and they waive the tuition as a benefit of being a state employee. And so I used that particular program and got my prerequisites all completed. And then I applied for a dental hygiene program. Seattle Central College didn't have a dental hygiene program at that time. And so the dental hygiene program that I went to was at Shoreline. And so I graduated from Shoreline with an associate's degree in dental hygiene. But now the dental hygiene program at Seattle Central College is a bachelor degree program. And we're in the process, as I was saying, with dental assisting, you can take an additional 6 classes and graduate from the dental assisting program with your associate's degree. We're getting ready to combine those classes into the program. And so within the next 2 years, the dental assisting program at Seattle Central College will be an associate degree program. And we also have a community health and education bachelor degree program at Seattle Central College. I happened to graduate from that bachelor degree program in 2019. So I got a bachelor's degree in community health and education. And then in order to teach in the classroom in dental hygiene, I needed a master's degree. So I went to school in 2020 and I got a master's degree in adult education. And so I finished that up at the end of 2020 and I got into a doctoral program. So now I'm in a doctoral program. And so I just recently started going back to school myself when I got hired at Seattle Central College in 2018. I hadn't been back to school since 1999. And so it's been a big transition for me, but you know, I can relate to students because I am a student. So, you know, I'm always willing to help out in any way, and I try to help create a great work student balance, or a student life balance, you know, because lots of students have to work. And so I just try to make it so it's not, you know, impossible to be successful. Any other questions about school, the college, dental assisting, dental hygiene? You can ask it, or you can throw it in the chat.
No questions from my end, but I do want to admire your background and your process. That is very impressive. So congratulations, by the way.
Thank you. I appreciate that. It hasn't
Not
been an
easy.
easy road.
Not easy. No, absolutely
No.
not. Yeah.
Especially going back to school, you know, after, I just remember my first day attending the community health and education bachelor degree program at Seattle Central College. You know, I came with a notebook and a pen, and everybody had their laptop and everything and their tablets. And I was looking around and I was like, can I get a copy of the syllabus? And they're like, it's online. And I was like, oh, okay, yeah, a little gap there, but I caught up.
All right. If there are no more questions, I think we're 10 minutes over here. But yeah, if there are no other questions, I think that'll do it for this program. So any closing remarks by Tracy or Max?
Oh, there's somebody. Oh, thank you. You're welcome. I just hope to see some of you guys. Please take my email information. Somebody asked what college. What did it say? Tino, somebody asked a question about a college.
Yeah, it says verbatim, what college does the dental program you need to attend? I'm guessing what college do you need to attend to get into a dental program, or what dental programs accept what colleges, I guess?
Oh, so the dental assisting program and dental hygiene program are at Seattle Central College, and there's other programs as well. And then if you want to become a dentist, University of Washington is the local dental program here. And actually 2 of the students in our program are currently doing their internship at the University of Washington. And so if you're interested in being a dentist, what's that?
How old you have to be like to intern like at the college to be doing like an intern?
Well, if you're in the dental assisting program, you just have to graduate from high school. I have 7 students right now that are Seattle Promise students. So they're just coming out of high school. The class right now has 19, and 7 of them are right out of high school. It's a pretty young class. If they didn't graduate in 2020, they graduated in 2019. The majority of the class are lower 20s, 19, 18.
Thank you so much, Tracy. This was really informative.
Yeah, absolutely. Absolutely. And if you guys know someone that's interested in the program as well, send them my way.